Stem cell therapy or injection. Today we're going to be talking about the procedure of stem cell therapy or injection that we perform at our center. We spoke in a previous videos about stem cell therapy and we spoke about its uses and how we do it. Today we're going to be talking about the procedure itself, how it's done and what to expect when you get this treatment. Now, stem cell therapy can be used for multiple purposes. However, today we're going to be focusing on orthopedic purposes, especially if the patient has a problem with a tendon, if the patient has a problem with a cartilage or a meniscus, or if they have osteoarthritis. Our patient has two problems today. He has a torn ligament or a torn tendon in the shoulder with osteoarthritis, and he has a torn meniscus in the knee with osteoarthritis, so he will be getting 2 injections. Now, the procedure is simple. It's done as an outpatient. It's not necessarily to be done in the hospital, and the patient does not stay overnight. We ask the patient to be hydrated and drink a lot of fluid the night before, just to stay hydrated and so they do not get dehydrated if we take blood from them or bone marrow, and makes things easier for us. Now, at the day of the procedure or the day before, we take small amount of blood so we can check for CBC, so we can check if the patient has anemia or not, and we check for the count of the platelets. We also do a coagulopathy workup, especially PT, PTT, and INR, to make sure that if we take a bone marrow that the patient does not bleed. Then after that, with my protocol, I combine the stem cell with platelet-rich plasma. So I take blood from the patient, about 60 cc's of blood, so we can isolate the platelets and we combine it with the stem cell. And the reason for that is that typically platelet, they trigger the stem cells to work. And so when we combine them together, the benefit is a lot better. And also platelets, usually with injecting PRP or platelet-rich plasma, the effect the patient starts seeing after a week. However, the effect of the stem cell takes about 2 months to 3 months before you see the effect. So when we combine them together, we give the patient the benefit of feeling better after 1 week until the stem cells kick in. Now, then after that, we draw from the bone marrow so we can isolate the stem cell. I usually use the iliac crest, and it's done under fluoroscopy. The patient lays on their stomach, and under the fluoro, we aspirate bone marrow. We aspirate it from 3 different sides. Typically, it's not very painful at all. We anesthetize the skin, we anesthetize the bone. However, when we pull or we draw the bone marrow, the patient might feel pressure-like sensation and pain at the initial draw. Now, typically this is felt more in younger individuals than older individuals. We draw at least 60 cc's of bone marrow. Then in the lab, we isolate the platelets from the blood that we took out, and we isolate the stem cells from the bone marrow. We combine them before we inject them. Now, the injection, it is crucial to be done under imaging guidance. So it could be done under ultrasound or fluoroscopy, depending on what we inject. Because the closer we get to the pathology, to the tear, the better the results are. If you inject them only in the joint, you might get some benefit, but it will not be good or long lasting. So, and that's why we inject it under ultrasound or under fluoroscopy. So the procedure is easy. We anesthetize the area, so really there's not much pain with it. Now, the pain can happen a week for the first week after the procedure. We give the patient specific pain medication to take because they cannot take any medication they want. Certain medications can interfere with the function of the platelets and the stem cell. And certain medications should be stopped 6 weeks or from 1 week to 6 weeks prior to the procedure, and also 6 weeks to 6 months after the procedure, depending on the medications. Now, what the patient to expect after the procedure, typically we keep them for half hour, then we release them home. We ask them to rest for about 6 to 12 hours after the procedure for the stem cells to stick and start functioning. And the patients start going back to their life slowly. It might take about a week before they go back to their baseline. And we give them the pain medication to suppress the pain during that period of time. After 6 weeks, we might ask them to go through physical therapy. Now, as we said, the platelet-rich plasma or the PRP function or benefit starts after a week. So the patient might feel better a week after the procedure, not from the stem cells, but from the PRP. However, the stem cells function starts at 2 months to 3 months after the procedure and can extend for months and years. We had done an MRI on a patient after stem cell therapy at 6 months, 1 year, and 2 years. At 2 years showed the best results. And therefore the function of the stem cells and the repair of the stem cells can extend for months or years. So as you see, the procedure is very simple and easy. It's done as an outpatient, and it can be very beneficial for the patient, especially if they have an orthopedic problem. Thank you.